on Tuesday, April 23rd. Julie, we haven't had it in the spring since 2019, so I think the spring just always seems to work out better.
I think it's always a good time. I think people are tired of being home. They're tired of being cooped up. And, now that the weather's starting to turn nice, I think everybody's looking for just ways to get out and ways to connect back with the community. So it'll be a good time.
Again, Tuesday, April 23rd. Now, we're going to be opening the doors an hour earlier. It's going to be 8 a.m. And part of the reason was because some of the tests that you do provide require fasting. So we don't want those people to go starve.
Absolutely. I think it's really a good move for us to open up at 8. I think when we opened up at 9, we had some people that just really didn't want to wait that extra hour for breakfast. We heard some feedback on that, and I think that was a good change for us to be able to boost it up an hour here. So where our folks will be set up, ready to go, and I know you've got a good lineup of people coming to the fair to be able to be vendors there. We've got some great people coming as well as our labs, so I'm really looking forward to it this year.
And of course, we're going to have Deanna's Java Station there, so when people get done with the tests and they're fasting, they can just head on over there and get a breakfast item from Deanna.
That sounds great.
Now, they will need to pay for that, and of course, they need to pay for some of the tests as well. Now, there is a total of 9 of those. Let's just kind of go over them real quick so people know. And again, this is all available on our website as well, krosradio.com. Lipid panel, that is a $15 cost, right?
Right, and that's a fasting. You should fast for between 10 to 12 hours for that. That gives people a real good chance to see what their triglycerides are and what their cholesterol, both their LDL and their HDL. LDL I always think of as the lousy cholesterol, HDL as the good cholesterol. There's a lot of information out there as far as what levels you should have and things like that. So, but it really does, it's a great way to really get a handle on exactly what your blood looks like on that.
Probably should point out now, when they do come and pay for these, just cash? Do you want just cash or a check?
Cash or check.
Okay.
We really aren't set up to take credit card at the Vista then.
Okay. Glucose, $10.
Yep, $10. It's a measure of the sugar in your blood, also a fasting test then as well. Okay. So make sure that you fast again for 10 to 12 hours.
Okay, HGBAIC or 1C.
Yep. We call it the A1C.
Okay.
It is $25. It's a test that monitors your blood sugar over the course of time. So, and I think it's about 3 months. So it gives you a number that basically tells you what your average blood sugar is. Also a fasting blood test. I believe I might have to check that again. But it is a good way to really know what your A1C is or what your blood sugar is over the course of time.
And of course, now you don't have to take all of these. You can just pick the ones that would best suit you. Vitamin B12.
Right, and that's a test that measures the B12 in your blood. So that's a $15 test. Some people who are low on B12, it is recommended that it become a certain level. I think that all of these tests really you should be talking to your doctor about as far as where you are in your measures. Vitamin D 25, that is also $30, helps with the growth of and the health of bone. We have our CBC, which is our complete blood count. And this is a measure of several tests that are used to determine the number and type of blood cells. If you want me to keep going here.
Keep right on rolling.
The Chem panel is $30. It's a comprehensive metabolic panel, That is a 12-hour fast. So if you're taking that one, do fast for that. And that's a group of about 14 different tests. Sometimes your doctor does recommend this for you. So you may want to check with your doctor if this is something that will give you a good glimpse of what is happening within your metabolic system.
Okay, just a couple more to go over.
Yep, the PSA, which is I'm trying to get the right acronym here. And it's not on my sheet, but it's a prostate specific antigen. Yep. It's a blood test that's used to screen for prostate cancer. So that's $25. And then the TSH is a thyroid stimulating hormone test that is for $25 as well. And that measures the amount of thyroid stimulating hormone in your blood and can indicate the thyroid response.
So again, your lab is going to be there. They will be set up, so you're going to have some registered nurses there.
Yep.
Some
absolutely.
qualified
some
people.
Lab techs.
Yeah.
So
okay.
Yep. So they'll be there right away at 8 o'clock, ready to go, and we'll also have blood pressures set up. So if you want to come and check your blood pressure, they'll be there from 8 till probably about 11 at least. Sometimes it does get a little less busy, and rather than just having them sit around, we do go ahead and let them go. But definitely starting at 8 o'clock, they'll be there. I like to check my blood pressure just to make sure that I'm still in line and everything. So, and that usually is pretty steady throughout the day.
All right. Again, MercyOne going to be the major sponsor once more. Now, you've got some booths that are going to be there. Let's run over who's going to be there from MercyOne for you.
So we will have a booth set up that has some information about our medical providers. So we've got a couple physicians who are leaving the area, so we'll have a list of physicians who are taking new patients. Ashley Schneider, we're trying to get her there, as well as Amanda Anson. Both of those are new nurse practitioners. So we'll have them, hopefully we'll have them there, as well as some other information about the different providers that we have at MercyOne, both at the medical center and then also at our area clinics. We'll have wound care there. So people in the past have been able to talk to our folks from wound care. This is a service now that's located in what used to be the old Windcrest facility. Now they just have a beautiful setup with their hyperbaric chambers up there. They're able to see people who have chronic wounds, unhealing wounds. And they'll be there to kind of discuss what their services are and how you can get started with that. As always, and I think from day one, the first time we did our fair, we've had our home medical equipment. So, more and more every year, people are wanting to live at home rather than go to nursing homes and things like that. And home medical equipment just has so many different devices that you can live safely at home. So they'll bring some of their, I think Annette Zemek used to bring what she'd call her toys, but there's grab bars and there's toilet seats and things like that that really do help you stay at home when you age. We'll be there with our volunteers, our wonderful volunteer corps that we have. We'll have some information there about how you can get started on that, as well as the foundation. And our therapy services, so physical therapy, occupational therapy, and speech therapy will be represented. Home care and hospice, a wonderful service that we provide in our community that does so much good for people who need that home care and hospice services, and our radiation oncology. So we have a full lineup of people who are, I really consider them to be experts in what they do. They answer questions and really do see if they can help you in what your needs are.
Again, visiting with Julie Dunn. Of course, you are with the foundation. Let's talk a little bit about that. How are things going on your side?
We're busy. We just approved some lead aprons for our colleagues to be able to purchase those. We're always looking for things that we can support and help our medical center to purchase. Medical equipment these days has gotten expensive, and so we're always raising money to be able to afford to purchase the new and upgrade new equipment. So we're very grateful to our CCDA last year, who gave us a $480,000 grant for cardiac ultrasound machines, and those are in full swing. We use them every single day. So we've been busy at the foundation.
Good to hear. Of course, we want to see a lot of folks out there. It's going to be on Tuesday, April 23rd at the Vista Grande, and that's a great venue. Parking is very accessible, and just walk on into the Vista Grande. We're getting a lot of great vendors there. And of course, you can go online, krosradio.com, up there in the banner at the up top. You got a picture of Andrew Stutzky. So if you got any weather questions, Julie, you can go on over.
I'm excited about him coming. I think that's going to be, I feel like he's a celebrity for us to meet and get his autograph.
Yeah, there you go. He'll probably give you one. And then, of course, we got the Clintones back. So we did not have them there the last time we had the Plus 50 Living Fair. And with the Clintones, you're also going to get a guaranteed group of people coming to the Plus 50 Living Fair. So if people want to find out more information about the foundation or MercyOne, how can they best do that, Julie?
They can go online, mercyone.org/Clinton. It has all of our information. You can find out about services and providers, If you look on the giving side, you can find ways that you can give back to the medical center. That's information about the foundation. We're right in the middle of scholarship month here, where all of our scholarships have come in, so you can find out information about that then as well. Lots of information. You know, the internet certainly has changed the way that we seek out information, and I think you can find just about anything.
Again, thank you so much for your time. I'm really looking forward to the event. Again, thank you.
Thank you. Enjoy it.
It's a bird! It's a plane!
The Dan Patrick Show.
Dan Patrick. Yeah!